Welcome everybody to Satori Health and Wellness. We're doing the Healthy Back webinar today at 7 p.m. We're excited to see you. We created this webinar series. It's called the Massage at Home series, just because a lot of people are staying at home, and so there's an opportunity to do things at home while we're in lockdown. If you don't feel comfortable coming into the clinic, so our two massage therapists, Victor Vizo and Sarah Brecker, are offering their expertise tonight to go through some exercises, teach you some better posture. So, we're excited about that. Our mission here at Satori is to help as many people as possible and to heal as many people as possible. And this webinar is really an opportunity to get out via the internet and via the web to spread all these things about how we can improve our posture and improve our backs there. Just a couple of things before we're going on. If you have an opportunity, have a question or concern, please type it in the chat. We'll try to do our best to answer that. There's also a Q&A function that you want to type in that will also prioritize your question from the back. We invite that to do that to encourage some engagement. Love to hear your thoughts about that. If you don't have it nearby, make sure you have a foam roller that's nearby. And second, if you have, make sure you bring a ball with you. You're going to use that to help with massaging it on the back there. If you have any, as I said, any questions, type it in the chat and we'll be excited to answer that. And let's get going. First person we're going to call up here is one of our massage therapists. Just to do a quick introduction, please welcome up Sarah Brecker.
Okay, hello, my name is Sarah Brecker and I'm a registered massage therapist. I've been working here at Satori for about 1.5 years now. I specialize in Swedish and deep tissue massage. I really love my job as a massage therapist. And helping people through massage therapy is an incredibly rewarding feeling. When you come to see me at Satori for massage therapy treatment, the aim is to establish what the client's goals are and what they hope to accomplish. Whether it's working through a specific issue related to pain and tension, or if the goal is to relax the mind and body through gentle relaxation. My job as a massage therapist is to listen, assess, and treat with the client's goals and what they want to achieve as the focus. I love being part of the team at Satori and encourage those in attendance today on the webinar to come see us at the clinic. Thank you very much.
Hello. No. Hi, my name is Victor Vizo. I've been a massage therapist for 12 years now. I've only been in Satori for about 6 months. Yeah, and Satori is a really good place to practice. We have a really good open and good ideas to help people.
Yeah. Do you have a favorite body part to work on?
A favorite body part? No, I love all of them. Yeah. Like whatever the client needs. Like I've treated jaw, like T&J. I've treated neck, treated feet, knee, back of knee, elbow, hands, front of the neck, chest muscles.
Yeah. And how come you how come you wanted to become a massage therapist?
I wanted to become a massage therapist because I like helping people, and feels like I'm solving a puzzle when I treat people. So it's a really good feeling for a client to come out with less pain out of my treatment.
Perfect.
So good.
I also heard, and I also smell it, that you're a very good baker as well. You made some cinnamon buns. Can you tell us what's going on with that?
Oh my God. I am currently in continuing education classes for baking arts. With the intention of going into baking. I'm gonna have my own bakery in the future. So it's cool. It's fun. It's fun baking.
Super.
Yeah.
Thanks, Victor.
Thanks, Victor.
Hey, before we move on, we're going to go to our first poll here. And so our first poll is going to be asking, where do you feel your back pain? And we're going to have that poll come up and, why don't you insert your answers here. And let's see what's the results. Let's take a look here. What's going on? Make sure we're punching in the results here. Can you watch over here? And tell me, so Victor, what do you tell me? What's the results on our poll showing?
Upper back 40, middle back 20, lower back 60. So
Okay.
Looks like lower back is the winner.
Lower back is the winner. Perfect. And let's go to our second poll now that ties in for the back. And what you have tried to relieve the back pain? If you can check all that apply, and let's see what the results come up with. Give you about 20 seconds to type those in. So it seems interesting. Sarah, what's coming up for some of the results?
Well, massage therapy is at 80%, stretching is at 100% right now. Okay, so now it's moving up to 89% for massage. And it looks like the remainder are all hovering between 22% to 56% for all the remainder of the selections. So I guess massage is really popular, which I guess that would make sense.
Stretching,
Well, I'm glad you're here.
stretching is number one.
Stretching is number one.
Well, I
okay?
think that's really important. That's something that you can do at home.
On your own.
We just want to, I want to let you know before thank you very much for sharing the results here. Before we move on here, if your pain we're here to help treat the pain, but if your pain is maybe going to hovering above a 7 out of 10, maybe it's to drop an email and talk to us to see what we do to help you with that. Okay, so now we're going to call back Victor to come up here. We're going to ask him a couple of questions about the back, as just a quick introduction, and then we're going to go into the exercises. Okay, so why are people coming in to see you to deal? What's a common complaint about the back when people come in to see Victor?
So like most of my clients, they work out and they do like compound exercises, and they find that they have like low back pain after squatting, deadlifting, stuff like that. Most of them are stuck on a chair and and now have low back pain. Their solution being that they just move around and stretch some of the musculature.
So what do you think what could clients be doing better when to make their back healthier? What do you think? What do you suggest?
Definitely posture is
Just the voice higher.
Definitely posture is one of the main things that you have to be aware of. Like a lot of the clients that I see or the people that I see are not aware that they're slouching or not aware of how they sit on a chair. Like a lot of them have like curved backs when they're sitting down. One of the main reasons I find is that they don't know how to brace. So bracing is basically used to create stability in your torso, ensuring that when you're, like for me, when I'm standing here, I'm not slouching like this, basically. So like I'm used to it because I do it all the time. But most of the clients that I see for low back pain, they're not very aware if they have a tilt in their hip, whether it be posterior, anterior. It also is maybe caused by muscle imbalances.
Sure.
It could also be caused by like rounding of the shoulders, and it just compresses like the spine
So you think it's true? So is it true that people can get headaches from poor posture?
Yeah. Like there's a condition called or not a condition, but we term it as a head forward carriage, where your head is basically like this, right? And what it does is it creates a false curve on the C spine, on your cervical spine, and sometimes creates a secondary curve. What happens is that it occludes some of the vessels on the base of the skull, and that might create some tension in the head.
Well, makes a lot of sense. We're going to go into our first exercise, but before we do that, here, just if you have any radiating pain, numbness, or tingling, that's the time to actually give us a shout. Before moving forward, that needs a little bit more personalized attention here.
Yes, especially nerve. When nerves are involved, it's best to see a professional.
Super, yeah. But let's go to our third poll here. Kobe, if you pull that up, does your posture really matter when it comes to back pain?
Yes, it does.
I think you just gave away the answer.
Oh,
Actually, there's a
sorry.
poll.
It's a poll, so
I think
we'll see what they say.
For sure.
Okay, I think everyone knows the answer to that. You
Cool.
just gave the
Yeah,
answer to that
yeah,
one, everyone. Okay, that was a free poll for everybody. Well done on that one. Okay, so why don't you talk to us? You're going to lead us through the bracing. What is bracing? Why do it? And then show us the technique on how to do it.
So bracing is basically you create stability in your torso by engaging your glutes, your abdominals, which is like your core, and your shoulders. So basically, when people talk about core, right, they think that's only the abs, but it's not really true.
Yeah.
The core is basically from your hips up to your chest, because all of that, when we're loaded, if we're, let's say, lifting, right, has to be stable in order for us not to crumple down and have this type of thing going on. I have a lot of clients who lift, and they have with squats, and they have the cue of tilt your hips before you go down. It's totally wrong. Because all of the load would go to your low back, and that's where the pain comes from, or one of the reasons why there's pain.
Perfect. Well, you want to take us through the exercise, or how to do proper
Bracing.
bracing?
So what I do with my clients is, depending on where their tilt is, right? So if their tilt is here, or if their tilt is there, they just have to find the neutral part of their hip. So what I do is, I get them to go to the very back and tilt their hip there, and then to the very front, right? And then go back to the middle. And that's where their neutral is. So that's the first part. And then what I do is identify their neutral, and then I tell them, contract your glutes, contract your abs, and then move your shoulders back and down. And it'll put you in a neutral, right? And so when you're hinging, when you're moving, your torso doesn't necessarily move, right? So if you're hinging from the hip, it's basically just your hip that moves, and then you can move your arms as well. And that's basically it. So it'll be glutes, abs, shoulders, back, and down. I'll show it on Sarah because it might look different on Sarah.
Okay.
So Sarah, if you could tilt your hip to the back, and then tilt your hip to the front, then find your middle, right? And then you're gonna contract your glutes, then your abs, and then your shoulders back and down. There you go. So that's your glute.
Mhm.
If you're gonna hinge, you're just gonna bend your knee a little bit and hinge and not move your torso. Yeah, just bend your knees more,
Mhm.
and then hinge. There you go.
Okay.
See how the torso does it? See, like another example is
He's coming back. He's oh yeah.
He's
There you
bringing
go.
the broomstick
Yeah,
now.
the broomstick, yeah.
gotta improvise. Okay, so for this one, you want to do it?
Okay, you just tell me what I'm doing.
Yeah.
'cause
So you hold it like this,
okay. Like
back,
this. Okay.
right?
Yeah.
So now you're going to touch your head to the broom,
Mhm.
touch your mid back to the broom, and touch your sacrum.
Okay. So.
Right?
Yeah.
So now brace,
Mhm.
right? And now you hinge.
Like this.
There you go. So just bend this more,
And then hinge.
right? So it's a good exercise, because then in order for you like to know how to that you're hinging properly,
Mhm.
all of these points has to touch that groove.
Mhm.
So curve your back the other way.
Mhm.
Yeah. Now hinge. Hinge more. Like curve your back more. Other way.
Other way. Other way. Other way.
Other
Okay.
way.
Yeah, yeah, yeah. Okay. And then bend knees and then hinge.
Yes.
Okay.
Uh,
Okay. Sure.
yeah. So now move your head forward a bit.
Mhm.
No, like forward.
Like forward,
yeah.
forward?
There, now hinge.
Now
We'll
hinge.
touch. We'll touch.
Okay.
Right?
Touch, touch,
So
touch,
if it
touch.
doesn't touch, then that means you're out of alignment.
Okay. So I need to be touching the whole line then.
Yeah.
Okay. So that's it.
There you go.
Okay.
Right?
Yeah. Excellent. Is that it? Are we good?
That's it.
Excellent.
So this is something that we can actually practice at home then to make sure we are maintaining posture.
Yeah. Like what I tell my clients is the point of knowing the sequence of bracing is to just practice it with your daily activities. Like let's say if you're gonna sit, right? You're going to sit down. A lot of people would sit like this, and then they would try to brace with just their upper back.
Mhm.
But then they get tired, so they go back. They go back to here. So what I do is I basically contract my glutes. It doesn't have to be 100%, it could be just 20%. So just enough so that you know that your glutes and abs are activated. So glutes, abs, shoulders, and then you sit, and you're already in that position, right? So you don't have to adjust. And then when you do that, like all the time, if there's deviations to your posture, then you know where to go, right? It's just being aware of where your body is in space. You know?
Super.
Right.
Now we're going to move on to our fourth poll before we see Sarah do some of our back exercises. And this fourth poll here is that we're going to talk about shoveling actually. So what's the safest way to shovel? I want you to select from one of the 6 answers.
Yep. All right. So push the snow. Okay, we have 50 and 50 right now. No, now we have 33, 32, 33. So we have a very even mixture. And okay, it's changing a bit now. Let's see. 60. Okay, it looks like the winner right now is going to be squat. Use legs to push up. Keep back relatively straight. 60%.
Yeah, we were talking to our osteopath here, Clara, and she was saying that she had noticed, or during the winter time, this shoveling the snow is always a common problem that causes some back pain. And I know we want to do our shoveling fast and we want to get it out of the way, but I think safety is pretty important when you're doing the shoveling. So let's focus on that when you're doing the shoveling and do it with the proper posture here. Okay, so we're going to have Sarah come down here, and she's going to do some exercises on the foam roller and the ball.
Okay. So Okay, so I'm just gonna talk for a quick second here and just let you know what we're gonna be doing. We're gonna be doing 4 exercises. One exercise is gonna be using a foam roller. One exercise is gonna be using a ball. So it's gonna be for ball massage. It's either a lacrosse ball or a tennis ball, something round that can move. And then we're gonna be doing 2 stretches. One is the cat cow, and then the other is the child's pose. And those 2 stretches come from yoga. They all target different areas of your back. Some focus more on your low back, some focus more on your mid back or your upper back. But it's a pretty good way in order to stretch out the full back and get some relief for your back pain. Okay, so I guess Daryl's he's gonna be filming me. So you're gonna grab your foam roller. You're gonna find yourself a flat spot.
So guys, we encourage you to get your foam roller and do it with us because this is a great opportunity to practice at the same time.
So you're gonna take the foam roller and you're gonna place it somewhere around your mid back. You don't wanna go any farther down your back than about the 12th rib. And if you wanna find your 12th rib, a good way to do it is you can find your belly button or your hips and you can just kind of direct your hands inwards. You don't wanna go anywhere below the mid back, not into the low back because that could be dangerous if you start to roll that out. So you place the foam roller into your mid back. Okay. And just start to stretch out. Place your hands behind your head. And for more support, you can cup your hands around your head. And if you find that there's an extra especially tense spot in your back, you can find it. You can extend your arms out and you can lean back into that stretch and you can hold it for upwards of 60 seconds. And then once again, you can bring your hands back up, cup your head, and continue rolling. And if you find another spot, another thing you can do is you can find that spot and just lean back and up. Lean back and up. Back and up. And if you want to get a better stretch in, fully back with arms extended above your head.
Beautiful.
Okay, how does everyone feel about that? Good? So we're gonna move on. We're gonna do our stretches first. So the next thing we're gonna do is it's a dynamic stretch. It's called the cat cow. You're gonna need to once again find yourself a flat surface. You're gonna get on all fours, hands underneath your shoulders, and then hips underneath your knees or knees underneath your hips. You're going to inhale for a count of 5. 1, 2, 3, 4, 5. Your head should be looking down at the floor, not eyes to the front, but down to the floor. Hold for a count of 3, and then exhale.
Come on, everybody, let's follow along here. Let's get some back relief here.
And then and
Nice.
your head should now be looking straight in front of you. Hold for a count of 3, and then inhale. Hold for a count of 3, and exhale. And you can repeat this as many times as you want, but maybe a good rule of thumb is to do this exercise 3 to 5 times. Getting into a fluid motion. And if you want, you can also make the noises as well. And then moo. only if you really feel like that's the one you want to.
It's always a crowd pleaser when you do that. Nice job. Okay.
Yeah, animal noises. Okay, so now we can stay actually on all fours for our next stretch. We're going to do the child's pose. So you're going to get on all fours. Okay, and if you have knee problems, what you can do is you can put a towel underneath the back of of your legs here underneath the knees, and that will offer you a little bit extra support. And then you're going to lean back, placing your glutes, trying to get them as close to your heels as possible while extending your arms. So you're gonna go back into the position, arms out in front, and push yourself back as far as you can go. Trying always to, while in the stretch, to get your glutes as close to your heels as you can. And then you can just hold the stretch. Once you've found your, maximum spot that you can reach, you're gonna hold it until you feel a release, or upwards of like 30 to 60 seconds. And then you relax. So those are 2 stretches there. I hope everyone was able to follow along and understand my direction. For our final exercise, we're actually going to move over to the wall. So you want to grab your ball. Okay. And we had 2 choices of balls, but I found that this one actually works a bit better for me. So we have a choice of this ball here, or this ball here. And also another thing you can do is you actually can tape them together in order to get both sides of your back at the same time, but we're just using one for today. So you're gonna go grab your ball, and you're gonna be placing this ball. We're gonna be targeting the rhomboids. So it's a ball massage that targets trigger points. And what you're gonna do is you're gonna place it between your spinal cord and your shoulder blade. So you wanna go get on both sides.
So find a wall, guys, and plant yourself with that ball.
Okay.
Follow along.
And you're just gonna roll into it. Roll into it. And if you find an extra special, very hyper irritable spot known as a trigger point, and you can also, if you want to really get to it, you can put your shoulders forward as well, roll them forward. Now I found a spot, I'm gonna lean into it, and I'm gonna hold until I feel that pain disappear, or else upwards of 15 seconds. Great, 1, 2, 3, 6, 7, 8, okay. So I felt the release, there it goes. And that's pretty much it, that's all you're gonna do. You can use this ball on any area of your back while standing, but we're just gonna do it in this spot for the rhomboids today here, for the demonstration. So then what you're gonna do is you're gonna take it and you're gonna put it to the other side. So you get both sides. Gonna grab your ball again, great. And I'm gonna just
Now, if
find that spot.
you're especially coordinated, you can actually do 2 balls at the time, but
Yeah.
that's if you are
Yeah.
especially talented.
Yeah, or you can tape them together like Victor had mentioned to me, which is a great thing to do, and then you can roll it up and down your spine. But right now we just have one, so now I'm gonna roll my shoulders forward because I really want to get into that trigger point and find it. Okay, great. And I'm gonna press in, good, and then I'm gonna hold. Okay, and I'm gonna release. And there we go. Let's see if we can. Perfect. Okay, so that's what you're gonna do for the ball massage, and that's I guess all 4 exercises that I have to show you today. So once again, we went over foam rolling, we went over the ball massage, cat-cow stretch for the back, and then the child's pose aimed at the low back. Okay, thank you.
Thanks very much, Sarah. I really appreciate
Yeah.
that. So, yes, Victor.
The question about the chair.
Oh yeah, we'll move on to that in a moment. I believe yes, Aaron has a question. So we got some comments here. They also said that Iris says you can place a ball in a pair of pants, of pantyhose, I guess, to make it easier. So there's one way to put in some socks, maybe to actually hold them together. That's a kind of cool idea, actually. Now that I think about it, so cheap and an easy way to get both sides of the back at the same time using those 2 balls. Thank you very much, Iris. Very, very useful. Clara, we also have our osteopath checking in here. Let the people know that if the ball is too hard, they can also wrap it in a towel too, and probably not push too much to create any neurological symptoms. That's right. If there's any radiating pain or numbness or you don't want to go too far. into that. I was wondering, is there any questions that we have from our attendees right now? Let's take a look here. I'll be back in 1 second here.
Okay. What are we looking for?
Is there any questions that are popping up?
Yeah.
Okay. Why don't you guys go up to the front and I'll ask you.
Okay. Yeah, great.
What do you guys think of standing desks?
Standing desk is only effective if you have proper bracing. That's my answer to that. Like, a lot of people think that that a standing desk is better off than sitting. For most of the time, yes. But if you're standing like this, then it's still not gonna work, right? So bracing properly is the best way to offset pain.
Okay. We also had an attendee ask a question about a chair. He's been trying all these different kind of chairs, and he's still having back pain. So do you have a chair to suggest?
It's like at this point in time, like the chair is probably not the problem. The problem would be his posture, or the posture would be the problem, not problem for it. What I would suggest is look at where he sits in the chair, and maybe put some more support at the back, and then brace properly. Or I think I saw that he sits up straight on the computer chair or dining chair.
That's right. He was talking about sitting in a computer chair and a dining chair.
Okay, so if you're sitting, let's say, in a chair that is long, right, and you're sitting in the middle, and you're braced, but if your musculature is weak, then you probably end up still slouching, right? And this is probably the part that hurts. So a pillow would help, right? A pillow on the low back would help. Then he can just sit farther and have that feedback on his low back to keep bracing. If he sits on a chair that is like shallower, what you do is you brace, and then you sit at the very back, right? Or if your foot is hanging off the chair, just sit a little bit forward, and then just lean. But bracing properly before you sit is probably your best solution.
Super.
Yeah. If the pain still persists, I think it might be time to go see a professional for that.
Super.
Yeah.
We promised there were going to be some prizes. So if you type in the word back in the chat, we'll make you participate, or you'll be eligible for a chance to win some of the prizes. So right now, type in the word back, and then we'll let you know who's the winner for that. And so we actually have one question here. Barbara's asking, is there any exercises without using the ball or any type of device? What would you do? Any suggestions for that?
Depending on like you can use TheraBands, right?
No equipment, Daryl?
No equipment.
No equipment.
To help strengthen or stretch, or what's the?
That's all she's asking. Any
Okay.
exercises to use without any balls?
If you don't have any pain on, you can do like push-ups.
I don't know.
Okay.
Yeah. So, Barbara, to answer your question, I mean, what you can do if you don't want to use a ball, or if you don't want to use a foam roller, you can just find yourself like the corner of a door frame, and you can use that instead of a ball, and you can press in those sore spots of your back into the corner of the door, and then you don't have to use a ball. You can get the same effect from using a wall
Yeah, just don't push too hard.
Just don't push too hard, but yes. If you're looking to do it without equipment and you don't have that stuff available, there is other ways to do it.
Super. Actually, we've had a request actually to do the sitting of the chair down again. I'm going to demonstrate with Victor coaching me and see if I do it properly here. So to reset, if I remember, because I am your client here, it's to find the glutes, tighten up the glutes, or I could find tighten the glutes, the abs,
Yeah.
and then the shoulder and back.
Yes. And then you just hinge from the hip.
Okay.
Yeah. There you go. Just watch her either. Sorry.
We're working on it. And so this allows you to get I do feel a good posture.
Yeah.
Yeah.
And
Versus,
if you fall out of it, like let's say you slouch, you just basically brace from the top. Right? It's not like the bracing is just an exercise so that you can integrate it into your daily activities, right? Like it's not necessarily like an exercise. It's just so that you're aware of where your body is in space, right? Because a lot of people are not aware that they're shrinking their neck or they're rounding their shoulders or like they're rounding their back when they're sitting.
but it's the best way to brace is actually to reset and stand up again and set it up versus
Yes. If you're new at it, then for sure you can just reset.
Eventually, we're going to have this in a manual for healthy backs on our website, so we'll definitely let you know when that happens. So, is there any other questions here? Let's take a look here. Looks like we're pretty good to go. Colby, do you know who's the winner for today's? We'll have two winners today for a prize.
Oh, need to bring down the.
Don't worry, Nick. You know what? Thank you very much. We'll actually give you a demonstration. We'll give you a copy of this video, or we'll give you the manual to show how to properly sit down if you aren't able to fully see that. But thank you very much for that feedback. Colby, do we have a winner for two winners for today's prize? Looks like it might have been frozen, so we'll have to get back to you on that one. Do you guys have any more back exercises to stretch the back?
To stretch the back.
Yeah.
You can foam roll your lats. Yeah. For lats, you're basically on you're basically on like a sideline position. You're gonna raise your arm like wherever you can, right? And then you're just gonna lie down and actually roll until you hit a sore spot, right? Like it doesn't necessarily have to be like super hard on the foam roller. It just needs to contact that painful spot. And if you just stay there, take a couple of deep breaths, it'll release. And that'll be it. Like that's for lats.
Super.
It's around here. That one would help you with your range.
Thanks, Victor. Well, we're at the end of our workshop here on the Healthy Back. Thank you so much for coming in here. We'll let you know when the manual is going to be available, when we're going to have a copy of this recording available up on YouTube in the next week or so. And then, we're so glad that you came by. Again, if your pain is more than 7 out of 10, or you're looking for some more attention for the back relief, please give us a shout at 416-972-9355. Visit our website and you make a booking. Thanks, guys. And until next month is going to be a special webinar. I'm actually going to be a guest on someone's webinar on March the 15th at 8 p.m. And it's basically where I'm going to be chatting about my experience as a clinic owner, what I've seen, and I wanted to share about, what we consider to be alternative healthcare and how can we bring that more mainstream that can take care of as many people as possible, because our mission is to heal as many people as possible. So we're excited about that. Thank you so much, and we'll see you next month. Check our website for more updates about how to register for my talk on my experience as a clinic owner. Take care.